Thank you so much, Renee. Excellencies, distinguished delegates, colleagues, a very good evening. As the WHO Pulse survey, which Somalia participated, indicates a substantial disruption of essential health services during COVID pandemic. Owing to this disruption of immunization services, we are at risk of reversing our hard-earned gain. In 2020-2022, our routine immunization coverage for Penta 3 has dropped between 10 to 15, while measles decreased 10 to 15. In 2022, the government of Somalia have conducted more than 10 acceleration campaigns to reach all his populations. With COVID vaccination, we have done 10 acceleration campaigns, 4 national and subnational for polio vaccination to respond to outbreak of the circulation vaccine, the rabbit polio type 2, and 1 national integrated polio, measles, and vitamin A to respond, and others like responding cholera outbreak in selected districts. Using all strategic possible, fixed sites, outreach, mobile to reach hard to reach area, nomadic, internal displaced, as well as marketplace, governmental offices, and university. Over 7 million doses of COVID vaccine was administered to adults. 3.2 million children received measles vaccination, and over 10 million of oral polio vaccine were administered. Community participation was another key component to reach this target. The community at all its levels, the local authority, community elderly, religious group, women, youth were involved since the implementation, the preparation and planning and the implementation of the campaigns. Effective communication begins with listening and understanding to key targets, and risk communication and community engagement was done massively. Massive communication, community engagement, house to house, megaphones, TV, radio shows, SMS, ring phone calls, community committee meetings, religious elder group, and information and education material were distributed across the country. We appreciate really our technical partners, WHO, Imprimis, and UNICEF for their technical support in these campaigns, the implementation and planning. Without them, it wasn't possible. We also use the polio network, which is huge, give us really access to hard-to-reach area in particular. We are thankful also our government partners, development partners, Gavi, COVAX facility, World Bank, other donors for their support, generous financial contribution. As we said, routine immunization coverage is really low in Somalia. Only 52 health facilities delivered immunization services. Particular immunization infrastructure, particular challenge we have immunization services, infrastructures compounded by human resource, also limited for inaccessible area security issue. Only 60% of these children eligible age group have access to basic immunization services. This is an urgent, especially in nomadic and rural people and IDPs, which constitutes 46% of our populations. Despite this challenge, you can witness how Somalia did her best to reach 40% of coverage of COVID vaccination in 2022, while in 2021 our coverage was only less than 10%. It means that we reach in 1 year 30% of our population with COVID vaccination. And also the number of childhood vaccine we have administered in a year, besides all our conflicts, our humanitarian emergencies, can witness. We can do more if we have adequate funding. Only $7 is needed to fully vaccinate a child. Somalia will need support to expand its immunization services and also human resource, including community health workers. I thank you, and back to you, Mr. Chair.